good to have you once again, Dr. Madzorera, on the show.
Thank you very much, Mr. Nyona.
Right. We are back and we want to talk again about COVID-19.
Yes.
It's a scare for everyone.
It is.
And in Zimbabwe so far, we've got about, say, 3 cases that have been recorded of positive COVID-19. And so far, we've got only 1 death. How do you think we're faring as a country? I think, is it positive news for us? Should we relax? Should we say things are well for us? What do you think?
The confirmed cases are still too few for us to make an assessment of our statistics. But I would like us to start assessing the statistics right now, even if we have a sample size of 2. The third case, I'm told, was eventually said to be negative. So we got 2 cases and 1 fatality, which gives us a case fatality rate of 50%. Let's start tracking that number because it's very important. As the number of cases increases, we will begin to see. We know in other countries they've had, in the end, case fatality rates of 2 to 3%. We would like to do better than that. Why? Because we've had a lot of lead time to prepare. Since December, when China announced these first cases, we've had nearly now 2.5, 3 months to prepare. So we should do better. And so as a country, we are not doing very well. A case fatality rate of 50% is not very good. Let's aim at lower figures, like 1%.
Then also, Dr. Madzorera, there is this case of the Makamba son. He had almost all the resources that he needed at his disposal, but he couldn't make it. What of the ordinary Zimbabwean on the street? Do you think we are ready to take care of the cases of the ordinary Zimbabweans on the street?
That was one extremely unfortunate case. I think we didn't handle it well. This is not a blame game. We are not trying to throw mud at anybody, at the government or anybody. But if we don't introspect, we'll never improve. They say a life that is not examined is not worth living. We must examine our lives. We must examine our ways, our preparedness, so that we improve on a daily basis. So when we talk to government and say, let's improve A, B, C, D, we are not just trying, we know it's a tough job. We are not just trying to pour mud on them. We are trying to tell them there's a problem here. We can solve it together. That case was not handled properly. Right from the start, the diagnosis of the case could have been done earlier. This is a young man who was coming from in New York, an area that we knew has got a lot of cases. It's actually, I think, the epicenter of the outbreak in America right now. We don't hear much about testing, about isolation before he actually fell sick. The young man visited many offices, high offices for that matter, after he came back from New York. All those things should have been looked into. When we say we are prepared and we are isolating and we are causing people to do self-isolation at home, what do we mean exactly? What is self-isolation at home if somebody can come from New York and then visit all of town? So that's the first problem. The second problem is case management. People have fallen sick. What do? We seem not to be prepared. And if someone like Zororo could have those kinds of hardships that the family tell us they experienced, and I don't know what an ordinary young man from Bari, a street vendor, would do. We are talking here about people who were prepared to hire their own ventilator to do a lot of stuff, but still he was not put on a ventilator and he didn't make it. So we really need to introspect and we need to improve our case management, our acute care facilities, and this goes on to the issue of human resources. You hear there is a thread of complaint that even the nurses were not coming frequently enough to see the patient. They can't if they don't have the necessary protective equipment. So we need to look at the issue of personal protective equipment for the healthcare workers so that they can work freely with the admitted patients and give them help. like we see on television the other nations were doing. And it makes you proud when you look at what China was doing and the PPE that they had, how all their health workers, were adorned with protective equipment. That's what we want to see at our institutions now.
Okay, thank you. Then, Dr. Madzorera, again, there is an ordinary Zimbabwean on the street. There is COVID-19. What can you advise an ordinary Zimbabwean to do so that they prevent themselves from getting COVID-19? Don't talk about masks and sanitizers, because probably the average Zimbabwean does not afford sanitizers or masks. What do you propose that they do to prevent?
To prevent getting infected with coronavirus? A very important question, and that's the message that we should always be hammering home to our people. That's the message that's going to save Zimbabwe. First of all, there must be a lot of consciousness among Zimbabweans that COVID-19 actually exists and is actually killing people big time. And once we know that and we accept it, we must begin to take measures to prevent it. And these measures are taken at a personal level. Each one should protect themselves. There are things like hygiene, hand washing. Let's wash our hands very, very frequently. Don't wait to wash your hands only after coming from the toilet. COVID-19 is not spread like cholera. It's a different bag altogether. Let's wash our hands frequently, very, very frequently. Because even when you touch a doorknob, you don't know who has touched it before you. When you touch a table, you don't know who touched that table before you and what they left. They could have left COVID-19 on the table. So this is much, I think, in terms of transmissibility, much worse than cholera. And hand washing is important. We cannot rubbish sanitizers because they are still important, and we want the government to come in and ensure that they somehow supply sanitizers to the nation. There are cheap ways of making sanitizers. When I was a young doctor, all the sanitizer we had in the wards was methylated spirits. So after seeing every patient would use methylated spirits in order not to transmit infection from one patient to the next, particularly in the children's wards, the pediatric wards. That still works. It's very effective. And at the end of the day, you may see your hands are flaky and white and dry. So that's why we encourage that you use some Vaseline or glycerin or something to make your skin smooth. So don't look at anything too expensive when we talk about sanitizers. Go to the grocer's shop next door. You'll find methylated spirits there. It works. Then, yes, masks work. But right now, you're going to town, you won't get masks in the pharmacies. So that's a big problem. Government must come in and make sure that they bring in these things en masse. People can buy. Most people can buy. And those who can't buy will then get donations. Social distancing, extremely important. And this is something that you initiate as an individual. The government can't tell you how to do social distancing. Make sure that you don't get too close to people, reduce huggings, reduce kissing and so forth. All those are necessary things. For the next 2 or 3 months only, we ban kissing. Social distancing. That means not going to gatherings, public gatherings, like weddings, funerals. Let's cancel all weddings and, funerals you can't cancel, but you can reduce the number of people who attend. Let only a handful of people go to bury their dead. Only a handful, to reduce all that transmission. So social distancing, there's a lot to it. That means people should work from home as much as possible. Those who can work from home, let's close our businesses as much as we can. And some essential services have to continue, but let's close businesses as much as we can. I'm now working only 3 hours a day, and I'm planning on reducing that to 2 hours a day, because we just have to reduce the contact we have with each other. Telephonic consultations for us as doctors. We don't want people to be coming to our rooms with cough and so forth. Just call your doctor. Hey, I got a cough, blah, blah, blah. You tell the symptoms. We assess how severe it is. We prescribe over the phone. and you make only a trip to go and buy your medicine from the pharmacy and come back. No greeting people in between. And we see, when it gets worse, you can always tell us. And um, we have a lot of ways of getting you to the hospital. That's where our ambulance services come in. So that is about prevention. Let me just talk about one thing. The elderly are particularly at risk. The elderly are particularly at risk. So we encourage the elderly not to get visits from their grandchildren. Just self-isolate, stay in your house, because the elderly have more than a double chance of dying from COVID-19 if they get it. And usually it's the young ones who bring it in. They've got healthy immune systems. They bring it in. They don't even know they are sick. They don't even know they are carrying COVID-19. So they visit Granny, they play with Granny, and they leave Granny a bed parcel. And Granny's immune system will not take it. If you are above 60, if you've got some other comorbidity, heart disease, any form of immunosuppression, stay at home as much as you can. Stay at home. Don't visit the city. Yeah.
And now that you have spoken about social distancing, are you sure it's possible to social distance in Zimbabwe? Because the majority of the people in Zimbabwe live from end to mouth. They are vendors. They do one thing today, and next they want to do the other. Do you think we can social distance and survive at the same time in Zimbabwe?
It's extremely difficult. I was talking to the vendors, and some of them were telling me that, I sell my wares today, and I go and buy enough mealie meal just to cook for that night for my family. Then tomorrow I come and I sell again, and I buy just enough. There are people who sell small packets of mealie meal in the marketplace, just for that. So it's extremely difficult. Our people have to survive, and government has to come in big time to rescue the people. That's what governments are there for. That's why we pay taxes, you see. So people like that still need to self-isolate at home. They can't. We should close all markets. Close all markets. But those guys need to eat. And the government should come in. Let them beg, borrow, do whatever they can to make sure that we feed the nation during. This is not going to last forever. It might last only 60 days or so. Maximum 90 days perhaps. So we should put aside a budget to look after the people for those 60 to 90 days. A budget that is not politically motivated, a budget that does not discriminate. Everybody should get food. We are all the same. COVID-19 is the same COVID-19, whatever political party you belong to, and we increase our camaraderie during this time.